Well, thank you for joining me here this afternoon in the Manitoba Legislature. Our government introduced important changes to the Manitoba Employment Standards Code. We are obviously at a very critical point in Manitoba's third wave in the fight against COVID-19 variant and of concern. Immunization is crucial to protect ourselves, protect our neighbours, and those around us. We want to encourage all Manitobans to get their COVID-19 vaccination as soon as possible. I believe it's somewhere around 45% of Manitobans have, and of course the age dropped very recently to, I believe it's 24 years of age. And we want to help remove barriers, and so people can get their can get vaccinated, so they're not worried about taking time off and getting paid. We also are proposing that we would make mandatory for Manitobans to take 3 days of paid sick leave or 3 hours of paid leave so they can get vaccinated. That's really important. We want Manitobans to be able to be confident to book COVID-19 vaccinations during work days or work hours without worrying that they're going to lose out on regular wages. That's really important to make sure that all Manitobans are vaccinated. Workers will also be protected to take a longer unpaid leave if they need more time to travel to vaccinate appointments or vaccination appointments and can't work due to vaccination side effects that you may experience. Since most of the vaccines on the market require additional dosages, employees will be able to take 3 paid hours for each dose. That's there. We obviously don't know if there will be booster shots in the fall, but this would cover that off as well. We strive to balance the rights of businesses and workers, so we do ask Manitobans to give their employer as much notice as possible and try to schedule appointments at least disruptive time for the business. Employers may ask employees to provide them with reasonable verification of the leave, but not a doctor's note, because we don't want to add additional burden to the medical officials and doctors while we're dealing with COVID-19. We've heard most employers in Manitoba have already made offerings or offered this type of vaccination leave to their employees voluntarily. We understand the importance of a vaccinated workforce, and we want to thank them for doing as such. These proposed changes are similar to what other Western provinces are doing to protect their workers. Again, this is really important to protect Manitobans and workers and get as many people vaccinated as we can. We've received support to proceed with these proposed changes from the Manitoba Labour Management Review Committee, which is an advisory body with representatives of employers and labour organizations right here in Manitoba. This paid vaccine leave complements our recently announced Manitoba Pandemic Sick Leave Program, which reimburses employers that voluntarily pay employees who need to take time off related to COVID-19. We want to encourage employees and employers to do the right thing. We all have a role to play in protecting ourselves and our communities here in Manitoba. And the faster we can get vaccinated, the sooner we'll be able to loosen regulations as well as restrictions to get our lives back. Thank you, and I'd love to take any questions that you may have.
Thank you, Minister. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Brandon Sun, Colin.
Good afternoon, Minister. How did your government come up with the 3-hour length for the paid leave with this program?
Well, we took a look at what other provinces are doing in Western Canada. As you probably know, Saskatchewan and Alberta and other provinces are doing a similar leave. We think that's an appropriate amount of time. We did consult with labor management that represents the business employers as well as labor organizations, and so we think that 3 hours makes a lot of sense to make sure that Manitobans get vaccinated. But essentially, we looked at what other provinces were doing.
Why not give a longer leave available to workers who have to travel from one city to another or one community to another to get their shots?
Well, they are. So for instance, maybe if you're in the north or if you have to travel to get vaccinated, they will for sure cover the 3 hours. And if there's other time, you would be able to get that time off that's associated with travel or things like side effects that you may have that would also be incorporated.
From CJOB, Schuyler.
Hi, Minister Fielding. Thanks for your time this afternoon. Just wondering if this program applies to only provincially regulated businesses or federally regulated businesses as well?
It applies to everyone in the province of Manitoba.
Well, that's an easy answer. Thank you very much. Just wondering, I guess, kind of a two-parter here. Why the province waited until 45-ish, maybe 40% of the workforce has got their first shot for this program. Just given today's stats, 45% of adults already have at least one dose. And also just wondering if any other programs or incentives will be put in place in the future in case, the province is kind of struggling to reach that herd immunity mark.
You know what? We've heard from both labor as well as business organizations that's going quite well, that employers are giving their employees time off. If you think of it from a business point of view, giving an employee 3 hours off as opposed to someone having COVID and having a real impact on your business, it just makes a lot of sense. I think all Manitobans are trying to do their part, and so we haven't heard that it is an issue, but we want to make sure that it's in legislation to make sure that's there. We also know, the second shots will be coming up that everyone will be entering into. I think there's 71,000 Manitobans that have already had their second shot, but for the most part, everyone will need their second shot and potentially boosters down the line. So this covers off both that second shot and the boosters that will happen potentially in the future.
Thank you.
From the Winnipeg Sun, Josh.
Good afternoon, Minister. Why is this not included in the sick leave program announced last week, and why does this this part of sick leave actually require specific legislation?
Yeah, good question. So a part of this, because we anticipate this going further in fall because of the potentials of boosters, we put it into the legislation. We were able to do the paid sick leave that Premier Pallister announced on Friday, I believe it was. That's something that's done over the emergency measures. That's something that will provide up to 5 days off for individuals. So if you've got side effects or anything else through vaccines, or you need to take some time off, it's up to 5 days. It's actually probably the most generous program really across the country in terms of the sick leave programs that's there. So this needed to be put into legislation because it could go further into the future. It is related to COVID-19, but we're very proud of the sick leave program that we announced late last week.
Okay. The Premier today announced that the age of vaccination eligibility will be dropping to 18 tomorrow. Does that kind of underscore the importance of this type of a program, and what does dropping to 18 tomorrow mean for economic recovery, especially as we're kind of in the middle of this third wave here?
Well, I'm the Minister of Finance, so I'm going to stick to the finance questions. The Minister of Health and Dr. Reimer will probably be making announcements for the vaccine levels. So I know the age drop, as you probably know, to 24 today, and Indigenous, I believe it's over 18. So I'm going to let them announce when it's ready to drop the age. But so far, we have close to 500,000 Manitobans, I believe, had their first dose. And that's upwards of, I think, 45% of all Manitobans have had their first dose. So that's a good, it's a good progress, but we need to really push harder to make sure all Manitobans get vaccinated. To specifically answer your question, the sooner we can get people vaccinated, the sooner we can get back to a normal course of life, as opposed to all the restrictions that we're doing right now. And if you look around the world, Israel and other places that are leading the way in terms of vaccinations, you're seeing them start to get back to normal. I think the UK obviously announced in June at some point, I think it's the 18th or 21st, for the most part, the restrictions will be lifted. So you can see in the very near distant future, if we're able to get people vaccinated, we're going to get back to our normal course of life.
From CBC Manitoba, Ian.
Good afternoon, Minister. I know you noted at the start here that most employers have been willing to do this already. I'm sure there are cases, though, in the past few weeks and months that it hasn't been allowed. Any consideration for allowing this to act retroactively in that employees that got time off would still get paid?
Good question. We did take a look at the other legislative pieces that other provinces have done. So it does take into consideration all future, right? So everyone will have a second vaccination as well as potentially booster shots that will happen in fall. So this will cover off people for the second the second shot, as well as future boosters that are there. I'm going to be honest with you, we've heard nothing but, for the most part, employers are giving employees time off to do this, but we want to make sure this is in legislation to make sure it is the law.
Regarding Friday's announcement for paid sick leave, employers have to apply for it, so it's voluntary. Why not make it mandatory for employers?
Well, we think that most employers are there's a lot of employers. In fact, I think 52% of employers have some form of sick leave for their staff or for their employees. So we think it makes a lot of sense. If you have an employer, for instance, you want to make sure that your workplace is safe. You don't want it shut down. So I think it makes eminent sense for them to have the program. They're fully reimbursed up to that $600 for 5 days. And so we think it makes sense for employers to enter into the program. They get reimbursed for this. It could be upwards of $60 million program, depending on how many people uptake it and use it.
From the Canadian Press, Steve.
Oh, hi, Mr. Fielding. Regarding the voluntary aspect of that program, you mentioned the percentage that have sick leave program. There's a large percentage that don't have sick leave programs, and we have a very high, almost a record level of community transmission and test positivity rates right now. So what is the holdback to making it mandatory to offer paid sick leave for those affected by the coronavirus?
Yeah, I don't think there's a hesitation. I think, number one, we're seeing a lot of interest from the business community as well as employees. You want to make sure that people are covered off. It's a very important program that people can apply for. They can get the money reimbursed, and it can make sure that their workplaces are kept safe. So I think you're going to see very much an uptake from the business community. There's advantages, obviously, to an employee who can have that time off if needed, but it's also an advantage to an employer, right, to make sure that your workforce isn't getting sick. I mean, the reality is, if you can give some people some time off and others don't get impacted, I've heard lots of stories where people had to shut down parts of their business because you have a number of people that have been impacted by COVID-19.
But you've given us reasons as to why an employer might want to offer this, why it makes common sense, but you haven't told us why the government will not make it mandatory. What is the hurdle to the government making it mandatory?
Well, we think that it's a program that businesses are going to embrace. I mean, it's a program that you can take advantage of. We know that there's a number of sick leave days. I think it's, again, 52% of workforces already have sick leave days for individuals. This is an opportunity for the others to make sure that their employees can have some time off if they're sick, to make sure that they're not getting their other colleagues sick with a part of it. So we think it's going to be very well uptaked the way we've designed the program.
From CTV Winnipeg, Mike.
Hi, good afternoon, Minister. My question is just about, as far as for employees who qualify for this program for the 3 hours of paid leave when they're getting vaccinated, will they receive that financial reimbursement directly through their employer, or are they going to have to sort of apply and get reimbursed at a separate time?
Kind of maintain their existing salary. So whatever level of income they're making, if it's an hourly wage or whatever, they would have that same hourly wage for those 3 hours. Now, there is an opportunity for the employer to recoup that, as I mentioned, through the sick leave program that was announced last week. Obviously, businesses can apply for up to that 5 days, so the businesses would be able to get that money back through that existing program that's there. So that's up to $600, 5 days. I think 5 days is the longest of all the provinces. Not all provinces have done the sick leave. Obviously, Ontario obviously introduced one. The federal government has a program right now. What's important about our sick leave program is there's some time frames you got to wait to apply to the federal program. I think it's upwards to a week. So this will cover you off, and having 5 days is one of the longest. In fact, I think it is the longest of all the provinces. I know BC has introduced, will be introducing a sick leave program soon. we're very proud of the fact that Premier Pallister worked across kind of party lines with the Premier from BC to really push initially for there to be a federal program, a sick leave program that was introduced. And of course, they did extend the longevity of the program in their last budget. So it is a longer program that's in place, but we're very proud of the program. We think there's a lot of benefits to businesses and a lot of positive aspects, obviously, to employees. They want to be as safe as they can and not get their colleagues or family members sick as well.
Okay, thank you. That's all the questions I had.
Our final reporter this afternoon from the Winnipeg Free Press, Timor.
Hi, Minister Fielding. This is Timor Durrani from the Winnipeg Free Press. Thank you so much for taking the time today for our questions. Minister, I understand that you will let provincial health officials talk about vaccinations, but a fellow reporter's question earlier had more to do with economic recovery, which is in fact your portfolio, with some really good news today when the Premier hinted that as of tomorrow, Manitobans aged 18 and up would be eligible to get a vaccine. I'm wondering if you can tell us what exactly is the provincial government doing with its economic recovery roadmap, which we have now learned has been in development for some time, similar to Saskatchewan's, that hinges on vaccination rates.
Yeah, well, I think right now I'm not going to get, I'm going to let the health officials kind of talk about the timeframes and vaccinations. That isn't specifically part of my everyday function, although you're right, if we get people vaccinated earlier, you can get our life back to normal. And you look at jurisdictions across the world, whether it be the UK or Israel, have gotten back. And the Premier is exactly right. We have been working on reopening plans, but I think right now we need to really focus in on the pandemic. We need to make sure that people get vaccinated as quickly as we can. So that's really the important part, and probably of all the programs that we've introduced in terms of business supports and everything else, the biggest thing we can do is get people vaccinated. I believe we're fourth now across the nation in terms of the vaccination levels, and there's upwards of 45% of people have had their first dose. So that's some good progress we're making, but we need to continue to move quicker, and we need to make sure that people get vaccinated.
Thank you, Minister. My second question is, since we're not being still provided with any type of contact tracing or modeling data yet about this, and all we heard from the Manitoba government until Friday was that cases are not coming from independent storefronts, do you agree that businesses have been lumped into the current new stringent restrictions to prevent the community spread of COVID-19 and not their own transmission rates per se?
Well, I'm not the Minister of Health, so I can't specifically ask you. Dr. Rusin would be able to tell you exactly where the spread is happening. Quite frankly, I think the spread is happening all throughout the community. Whether you're in business, whether you're in, you're visiting people at home. Hopefully, people are following all the health rules that are in place. So it's happening kind of throughout our community. So at the end of the day, we need to get as many Manitobans vaccinated as we can to make sure that they're protected. And I think we made some good progress on that. We will want to engage further with the business community like we did during the first reopening last summer in terms of what that looks like. I think Saskatchewan has a pretty good model, pretty good document in terms of a kind of a roadmap going forward. Quite frankly, we'll be in meetings later on this afternoon with other officials to talk a little bit more about that. But our main goal right now is to make sure that people get vaccinated. That's what I'm here to talk about in my role as Minister of Labour, not just in finance. And so this will provide some reassurance and give some employees some 3 hours off to get vaccinated. And there's also obviously a paid sick leave program that we think will benefit businesses as well as individuals here in Manitoba.
Thank you, Minister. This concludes our media briefing.